I've been involved with the AHA since about 2007 when we initiated our state STEMI program, the Virginia Heart Attack Coalition. And since then, we've been working in collaboration with Mission Lifeline to improve STEMI care in Virginia.
American Heart Association put into place Mission Lifeline initiative to really improve systems of heart attack care, or MI care. The AHA is promoted through Mission Lifeline to develop systems of care starting with EMS, the emergency room, and then the cath lab.
Whether they present directly to the emergency department, come in by ambulance, or require transport, its goal is to be able to provide rapid restoration of blood flow to the heart in patients who have a myocardial infarction or heart attack.
Mission Lifeline has enabled EMS to communicate with the emergency room, and the key to this is the 12-lead ECG, because that's really the diagnostic tool that tells us that there's a heart attack in process.
The care of patients who have had heart attacks is also critically dependent on the success of the initial CPR. If that is not done and adequate blood flow is not supplied to the brain until definitive care can result, the patient can suffer severe brain damage.
Sunday morning we woke up and Mitchell was complaining of chest pains, back pains. I left him in his bedroom and I came back and he was on the floor. I realized what was going on, so I picked up the phone and I dialed 911 and I put it on speaker and I started CPR. I had somehow managed to use my cell phone and Mitchell's cell phone to call his mom as I was on the phone with the 911 operator.
My phone rang and I could see it was Mitchell on the caller ID, but when I answered it, I couldn't get anybody to talk to me, and then I heard Gretchen's voice and she was counting. And it took me about 2 seconds to realize she was doing CPR. I remember thinking for the first few minutes, please God, let me wake up. Please let this be a nightmare.
I'm sitting there performing CPR and screaming at him and crying at the same time. I just saw our whole relationship flash before my eyes. Hold on, now I'm crying.
The call came in, we arrived on the scene. We were directed down to the basement where we found a young lady doing chest compressions on a young man. We assumed CPR, we put the gentleman on a defibrillator.
They brought out the AED and used the pads. And I never thought I'd have to hear the word shock advised on anyone that I knew or loved.
We did a 12-lead EKG, which we're using to get the hospital ready for a STEMI, a patient that's having a heart attack. So we can take a picture and then call the hospital and say, hey, we'll be there in 25 minutes with a heart attack patient.
And they kept saying they don't know if he was gonna make it.
It was so hard. It was really the scariest day of my life.
I had an acute anterior wall myocardial infarction, which is really a heart attack due to blockage.
One of the arteries supplying his heart muscle became completely blocked. As a result, there was no blood flow to that part of the heart, causing heart damage.
It was just such a relief when he woke up and opened his eyes, and we could see immediately that he recognized us.
Fortunately for him, his girlfriend performed bystander CPR and was able to sustain that until EMS came.
I'm CPR certified. I have been since 2007. I've taken a CPR course every year.
We just have to express how grateful we are for Gretchen for being there, for being trained in CPR and making the call to 911 and getting the whole process started.
Her being there, by my side, just like she is pretty much every day, I'm grateful for. I'm glad she was there. I'm glad to still be kicking, still be, just living my normal life.
Mitchell Harrison is an amazing case of survival that wouldn't have been possible really without the Mission Lifeline initiative from American Heart.
Because of all the excellent care that Mitchell got through the whole process, shortly after coming home from the hospital, he was able to go back to all of his regular activities.
It's an example of what the American Heart Association is trying to do every day to promote awareness of heart attack symptoms, but also CPR.
I'm just so thankful that the AHA provides CPR guidelines and train millions of Americans, just like my girlfriend, Gretchen.
We are just extremely grateful because that's why we're still a happy family today.
Whatever we can do through Mission Lifeline to diagnose and manage heart attack cases earlier, patients are going to have much, much better outcomes.